Hi, I'm Dr. Jennifer Herrman. I'm a dermatologist or a skin doctor at the University of Alabama in Birmingham. And today we're going to be discussing how you can protect yourself from getting skin cancer. Come to my office with me and we'll meet a patient to discuss this. Hi, Mr. Hall. How are you?
How are you doing,
It's so good to see
Doctor?
you again, Dr. Herrman.
Nice to see you.
Last time you were here, you had quite a sunburn.
Yes, well, I was just trying to get, a nice tan when I was at the beach. Isn't a little bit of sun good for me?
Well, that's a very good question, and so many patients do ask about that. But the bottom line really is there's no such thing as a safe tan. What a tan really is it's a sign of your body trying to protect itself. When the sun rays come and hit your skin, it activates cells that produce pigment. And that pigment spreads out over the top of the skin to try to shield all the other cells underneath. And that shield really is a form of protection. So, when people ask, is a tan healthy? The answer is really it's not. It's a sign of one of your body's defense mechanisms really at work.
Okay. Well, what about vitamin D? Don't I need vitamin D, and can I get that from the sun?
You absolutely do need vitamin D, and you're right that your skin can make vitamin D when it's exposed to the sun. But, you don't really need to go outside and sit in the sun to get adequate vitamin D. If you're really worried about it, you should ask your doctor, and you could certainly take a vitamin D pill. But it's actually only about 30 minutes per week of sun just on your face, arms, and hands that maximizes your body's ability to make vitamin D from the sun. So any more exposure than that, and you're really just damaging your skin.
Well, what would be the best way for me to protect my skin?
Well, that is a great question, and there's lots of things that you can do. I like to tell all my patients to become sun aware, and that basically each of those letters stands for something. So A stands for avoiding the sun, and it's really best to try to avoid the sun during peak hours, so between 10 a.m. and 2 p.m., because that's when the sun is really most intense. W stands for wearing protective sun clothing. And now this can be anything from long sleeves to long pants to hats. And really the best type of hat is one with a broad brim. Now obviously this is not for a guy, but a fishing hat or something that protects your ears and neck is really the best type of hat to get. Baseball hats are okay, but they really only shield your face. They don't protect your ears and neck at all. So wearing protective clothing is certainly important, and there's actually a lot of companies now that make sunscreen in the clothing, so that's kind of cool. It makes it easier.
Oh, wow.
The second A stands for applying sunscreen, and this is really important. Everyone's heard of sunscreen, and I got a lot of patients ask about what type of sunscreen to use. And really, if we're talking about the different brands, it doesn't matter so much. But it is important to use a sunscreen with an SPF or sun protective factor of at least a 30. 30 is a good minimum. Anything higher than that is fine. And it's important to put it everywhere and to reapply it every hour or so. And if you're swimming or sweating and it's running off, you need to apply it more frequently. Another thing people ask about is how much do I really need to put on my skin? And it's actually more than most people think. It's about a golf ball amount that you need to cover your whole skin.
Okay.
So if you use an SPF of 30 and you only use a tiny little amount over all your skin, you only use half that golf ball amount, you're only going to get an SPF of 15. So it's like any other medicine. You really have to take the correct dose of it.
Okay.
So make sure that you put enough on and cover everything adequately. The R stands for routinely checking your skin, and this is important because the better you know your skin, the better you are going to be at finding something new or changing. I like to tell all of my patients to check over the skin about once a month. Just look yourself head to toe, get your wife to look at your back if you can't see it well, and look for new or changing things. And if you have a question, go to your doctor, ask your doctor about it. And finally, the E talks about educating yourself and others about skin cancer and sun protection. The more people know about this topic, the better everyone is because people know what to look for and know when to get checked.
Okay.
Any other questions?
Well, yes. Actually, I was going to ask about my newborn.
Okay, well,
I have a newborn.
congratulations.
Thank you. what about sunscreen on small babies? Is that okay?
That's a great question. A lot of people ask about that. And really, an infant, until about age 6 months, their skin is just too sensitive for the sun. So it's really not recommended to take them out in the sun at all.
Oh, okay.
So really try to keep her shaded during that time. At 6 months, it is okay to use a sunscreen. And actually, a lot of these sunscreens are great for kids. This is a spray. Teenagers like that. But this one is for babies specifically. There's very few irritants in it, and so it's really good for their sensitive skin. Clothing is also very important. Make sure you've got a big hat, and there's a lot of companies that make that SPF clothing perfect for babies, so I'd recommend both of those things. But that's a great question. Anything else?
I think that's it.
All
Thank
right.
you.
You're very welcome, sir. So the main things to remember are, first, there's no such thing as a healthy tan. All tans caused by the sun or tanning beds are a sign that your skin's being damaged. Second, you don't need to sit outside or in a tanning bed to get adequate levels of vitamin D. And third, when you're outside, it's really important to protect yourself and your children from the sun. We have a great state with lots of wonderful things to do outside. So I don't want you to not go outside. I just want you to protect yourself when you are out there.